Yes. Hello.
Hello. Yeah, shall I begin?
Yes.
Hi, good afternoon, everyone. I'm Dr. Aravinda Lochani, consultant neonatologist and pediatrician at KIMS Cuddles Kondapur. At the outset, I would like to thank everyone for making me the speaker of today's session. The topic that has been given to me to share the knowledge about is the benefits of breastfeeding. So, everyone knows, like mother's milk is the best milk for a newborn baby because the mother's milk is specially made for her own newborn. It contains a lot of like immune factors, growth factors, and nutritional benefits when compared to any other milk. Like animal milk, cow's milk, and all people used to give in olden days, but that is not at all recommended for a newborn. Now, at this stage, like many people know, like the benefits of the breastfeeding. So now we will go through what all you should know about the breastfeeding and how to initiate the breastfeeding soon after birth. So as soon as your baby is born, whether it be a normal vaginal delivery or a lower segment cesarean section, the breastfeeding can be initiated as soon as of after birth. So whenever the baby is born, the baby will have good sucking reflexes, which are helpful for breastfeeding, namely the rooting reflex and the sucking reflex. So the baby is put soon after birth to the mother's chest, and that helps the baby to initiate his or her own breastfeeding with the help of these reflexes. So the earlier the breastfeeding is initiated, the mother can initiate and give breastfeed for a longer duration. According to the NFHS 5 data, unfortunately in our country, the initiation of the breastfeeding and the continuation of the breastfeeding for a longer time, that is for more than 6 months, is at a very low percentage, that is only at the 40%. So we all should try to improve these breastfeeding rates by encouraging and motivating the newborn mothers and by following the baby friendly hospital initiatives where the initiation of breastfeeding should be done within 30 minutes after birth, and the continuation is also an important aspect. So let us explore the benefits of the giving breast milk to the newborn baby. So whenever the newborn baby receives exclusive breastfeeds, the baby is less prone to infections. Mainly, the first thing is the baby is less prone to infections like upper respiratory infections and gastrointestinal tract related infections like vomitings and diarrheas. And subsequently, the infections that lead to hospitalizations are also reduced. The babies are prone to lesser infections, lesser ear infections also, and they tend to have higher intelligent quotient when compared to formula fed babies. And the baby's general immune system will be a lot better, and the overall health and immune status of the baby can be improved by giving exclusive breastfeeding. For the mothers also, there are certain benefits like decrease in the postpartum hemorrhage. That is the blood loss after delivery can be minimized by giving exclusive breastfeeds, and her postpartum depression and her stress levels will be lesser if she tries to feed the baby. And the overall general bonding between the mother and the baby will also improve by providing exclusive breastfeeding. The baby's IQ rates will become more, and the lesser chances of autism and all will be lesser when in the subsequent years of their development. For premature babies and for babies who are born with low birth weight, the chances of feeding intolerance will be lesser if exclusive breastfeeding is provided, and earlier discharge from the hospital can be ensured if the exclusive mother's own milk is provided. Apart from this, the babies who are breastfed have good immune system and good digestive system compatibility in when compared to the formula feeds. So these are the general benefits of the breastfeeding. So, by providing early skin to skin contact, the baby's body temperature, a condition known as hypothermia, can be prevented, in which the baby is not able to maintain her body temperature. This can be controlled, and the breastfeeding rates can be improved. So, whenever a baby is born in a hospital, early skin to skin contact and early initiation of breastfeeding should be always encouraged. So, next, coming to how to sustain this breastfeeding. So, what are the problems that the mothers face generally in the as soon as the baby is born? So, the primary complaint would be the baby is not latching properly. So, that is the common complaint. So, this can be overcome by providing adequate number of lactation counseling sessions for the mother. This is preferable if it is begun antenatally itself, where the mother should focus on providing the exclusive breastfeeding after the delivery of her baby. And she should take care of her nipples, make sure that there is no nipple issues like inverted nipples or flat nipples, and modify them for the breastfeeding subsequently after the birth. And so that is the main thing. And latching issues, nipple issues. The other thing is the decreased supply of breast milk. Most of the time, soon after delivery, when we go and meet the mothers, they complain that her milk is not sufficient for her newborn baby. So, if you see in the first 2 days of life, the mother will be producing a few drops of light yellow colored milk, which is known as colostrum, which is very much high in immune factors, which are important for the improving the overall immunity of her newborn. So, in other words, the providing the colostrum for a newborn baby is always referred to in medical terms as the first vaccine for the baby, as we are giving the polio and BCG shot soon after birth. So, the providing the breast feeding is called as the first vaccine of the baby, and this should always be encouraged. So, in the first 2 days, the obviously, the mother, as she is producing only the colostrum, it will be light yellow or white in color, and it will be quantity will be less. And if she presses and sees, only few drops of the milk will be seen. That doesn't mean that the baby is starving. The baby, if the baby is frequently put to the breast of the mother and frequently allowed to latch and suck, then only the milk production will start. The coming in of milk, so the is due to the change in the hormones, increase in the prolactin hormone, which happens after the delivery, and that will help in the coming in of the milk and production of the mature milk for the mother. So this happens in the third or fourth day of the postpartum period, when she will start producing normal mature milk, which is white in color, and then her milk output will gradually increase. So the next doubt which mothers will have is the on the by the third day or fourth day, if this latching and sucking and frequent feeding is not habituated for the baby, they will go into engorgement. What is engorgement? Um, the mother will have pain and swollen and fullness of her breast, and she will also have lot of discomfort. This is because the increased blood supply will be there to the breast, and increased milk production will also happen. And if the baby is not latching and sucking adequately, this will lead to pain. So, what will be the treatment for the engorgement? The mother should frequently try to express the milk, and hand expression is the best form of expression in the initial days of life. And then she should try to feed the baby frequently so that her engorgement will become lesser. She can also apply some cold compresses to the breast to ease her pain. Then, very rarely, some other conditions like mastitis, where there will be inflammation of the breast alveolar ducts and the tissues, and also abscesses, where there will be a frank pus and local rise of temperature will be noticed. Here, it should be treated with antibiotics with the advice of your obstetrician. So these are the common issues that the mothers face. The first thing is um, uh, not initiating the breastfeed soon after birth. That is the first thing, which can be overcome by following the baby-friendly hospital initiative and aiming for early skin-to-skin contact, early latching, lactation consultation, and then frequently feeding the baby. If there is a less production of the milk, that will increase gradually as the mother feeds the baby frequently. So here they should not feel that her milk is not adequate for the baby, because the colostrum will be produced in minimal amounts in the first 1 to 2 days. Then later on, the production of the mature milk will be there. And here, any latch related or nipple related issues should be taken care of. And giving night feeds to the baby is very important. Then comes the question, how frequently she should feed the baby. So breastfeeding should be done as frequently as every 2 hours, and it should be done for at least 30 minutes. So each side of the breast, she should latch the baby for 15 minutes. So 15 minutes each side. So total 30 minutes every 2 hourly. Mother should aim to give 12 feeds in the initial days of life. Then later on, it can be decrease it to 8 to 10 feeds as the baby grows up. Night feeds are very important. So, night feeds and early morning feeds lead to good hormonal production, prolactin production, and longer sustenance of the breast milk. Then the day 4, day 5 problems are engorgement. So these can be relieved, that we discussed upon. And exclusive breastfeeding should be given for the first 6 months of life. So once the mother achieves this in the first 5 to 7 days of life, then it will not be a problem for her. It will be an easy ride for her. So the first 1 week of life is the point of time where the mothers need maximum support. So this can be started from the antenatal period and they can be guided adequately. So how we will know whether the mother's milk is adequate for the baby or not? So ideally, any newborn baby, they lose around 2% of their weight every day in the first 4 to 5 days of life. They generally, up to 10% of the weight loss is normal. And then they reach the birth weight by 7 to 10 days of life. So supposing if a baby is born at 3 kg, the baby will lose the around 8 to 10% of the weight in the first 1 week of life, and the baby should regain that birth weight by 7 to 10 days. Supposing if the baby is losing the weight excessively, more than 2 to 3% per day, then we say that the mother's breastfeeding is not. We can think of other alternatives like expressing the milk and feeding the same expressed breast milk with spoon to the baby, and simultaneously same for the latching and sucking issues, such as the baby might have an oral tongue tie where the tongue is attached, base of the tongue is attached to the base of the mouth. If there is any such issue, if there is any shallow latch, if the suck is not appropriate, in some cases when the mothers introduce the bottle feeding to the baby, so earlier on, so the baby gets usually adapted sucking at the bottle. So the tongue movement of the baby and the pressure that is required is different when the baby is directly latching at the breast when compared to the bottle. Then that may lead to the nipple confusion and some feeding issues. So these can be identified and corrected. And then the support can be given to the mother. And the any other issues like if the baby is having any oral thrush, mother is having any fungal infections of the breast, which is called thrush, can also be looked into and treated appropriately. So once these challenges are overcome, then most of the mothers, they feed at ease. Breastfeeding is easier when compared to bottle feeding. Why? Because breastfeeding leads to decreased incidence of infections. You need not clean your breast each and every time when you feed the baby. While if you are giving a bottle feeding, the bottle needs to be cleaned thoroughly in hot water each and every time. So every time doing this will be cumbersome for the mother, and that also leads to chances of infection for the baby if the cleaning is not done appropriately. And when compared to formula feeding, the breast milk is easier to digest. The proteins which are available in the breast milk are at right amounts for the baby and helping easier digestion and brain development also. The carbohydrates also similarly are easier to digest for the baby and lead to easier absorption from the gut and decreased incidence of diarrhea and feeding intolerance when compared to the formula milk. The fats which are available in the breast milk are also ideal for her newborn, and they contribute to the brain development by having the DHAs, docosahexaenoic acids, which are in adequate amounts in the mother's own milk. In addition to these factors, the mother's milk also contains a number of growth factors and are essential for the brain development of the newborn. Till now, we have seen the benefits of the breastfeeding, and we have seen how to overcome the challenges in the initial part of the life. And usually, after getting discharged from the hospital, mothers are now getting the maternity leave up till 6 months also, where they can exclusively breastfeed the baby till 6 months. The World Health Organization recommends exclusive breastfeeding till the 6 months of age, then followed by introduction of solid foods, that is complementary feeds after completing 6 months, and then continuation of the breastfeeds till 2 years of age for the newborn. So this should be tried to be followed. In some cases, there will be some issues like the mother will rejoin her work. So then how to ensure the continuous provision of the breast milk to the baby? So in such cases, we can take the help of breast pumps. So this is one aspect where the mother should read about it before, see some videos, how to pump the milk, how to store the milk, and have some prior idea, and start doing this at least 1 month before she joins for her work. So, in such a case, the mother's milk can be expressed with the help of a electrical breast pump. Electrical breast pump is superior than the manual breast pump. Initially, I said in the first few days of life, manual expression, hand expression is better than um, breast pump expression, because in the initial days when the outflow of the milk is less, if they use the breast pump, then she might have the pain. So later on, when she has started feeding the baby and she's good into the breastfeeding, then electrical breast pump can be used. So it's ideal to choose any good branded breast pump. There are so many brands available in the market. Mother can see and choose like flanges and the technique of the breast pump, the machine, ease of working on the machine. So everything you can see and choose an ideal pump for you, and pump frequently. So the second thing, there is a myth called like if the breast is full, then she will be able to give more milk to the baby. So that is not the case. Frequent pumping, the breast should feel soft. So if the mother is going to office, so she should try to pump every 3 hourly and store the milk in the bottle. So how long the expressed breast milk can be stored is the next question. Usually, expressed breast milk is given to preterm babies who are in the ICUs when the mother is not able to directly feed the baby and the baby is not able to latch and suck effectively. This happens in the case of premature babies and in the case of working mothers. So a mother should pump the milk every 3 hourly, even if she is in the office. And the expressed breast milk can be stored in the room temperature for up to 4 hours. And if it is stored in the refrigerator, it can be stored for up to 24 hours. Even then, even after pumping, if the mother is having excessive milk, which she wants to use later, she can store it in the freezer for up to 3 months. So this happens rarely. So the for the day-to-day use, the milk which is stored in the refrigerator can be used for up to 24 hours. So if that milk needs to be given to the baby, then it should need to be warmed slightly. So that can be done like double boiling. So you will take a vessel which is filled with lukewarm to hot water, and then you will dip the bottle which you have pumped and stored the milk in that bottle. That bottle will be dipped in that lukewarm water. And once the milk comes to the normal room temperature, then we can feed that milk to the baby. So, in that way, the working mothers can sustain breastfeeding for a longer time. And this preparation should be done a few days in advance before joining, and try to give that feed to the baby. See how the baby will adapt to that mixed feeding. So, suddenly means the baby may not accept the milk. In such a case, also, they face the problems. So, if you have even excess amounts of milk, which is more than enough for your baby, then you can donate the milk. We at Kim's Cuddles are proud to say that we have a human milk bank where we process the donor human milk. Donor human milk is a term which is used for a baby. We are giving the milk other than her own mother's milk. So, where we process the donor human milk and pasteurize it and then feed it to the babies. So, this will be helpful for the babies who are premature and don't have the privilege of their own mother's milk. So, so these are the guidelines how to pump, how to store the milk, and how to rewarm and use the milk. If you are keeping the milk in the freezer, then you have to thaw the milk. Means we have to bring the milk to the liquid state from the solid state. So you can keep the milk in the refrigerator for some time until it liquefies a bit, and then you can dip it in the hot water. And once it comes to the normal room temperature, you can use it for your baby. So the milk once that is thawed means once which is brought down from the freezer to the normal fridge should not be frozen again. Then the other common query is how long to breastfeed the baby and what are the different components of the breast milk. So if you see the milk will have different components. The milk which comes at the beginning of the breastfeeding is called the fore milk and the milk which comes at the end is called hind milk. The milk, fore milk is watery and it contains a lot of carbohydrates or sugar content will be more, which will satisfy the thirst of the baby. The milk which comes at the end is called hind milk, which will be rich in proteins and fats, which will satisfy the hunger of the baby. So many times you will see the mothers will not feed the baby for a longer duration and the baby will be frequently hungry and gassy, and when the baby is passing stools also a lot of lettuce will be there and perianal rash will be there. This is because the mother is feeding only the fore milk to the baby, which is rich in sugars. So only the baby's thirst will be satisfied, but the hunger will not be satisfied. So, because of the excessive carbohydrate content, this is processed by the bacteria in the intestine and they will tend to develop the perianal rashes. So, this we can identify by looking into the history of the mother and asking her how long she is breastfeeding. This is called as fore milk syndrome. In such a case, we should advise the mother to feed the milk entirely, to empty the breast entirely by feeding the baby for at least 15 minutes and then only switching to the opposite breast and finish the feeding for a total of 30 minutes. This will ensure that the baby consumes adequate amount of proteins and fats also that will lead to the muscle building for the baby. The next common complaint in the first few days of life is the babies will be sleepy a lot. Then, how to ensure this too early breastfeeding in the first few days of life? So, we should try to wake up the baby gently by rubbing the baby's ears and flicking the soles and by undressing the baby and maintaining a skin to skin contact while the mother is feeding the baby. So these are the common methods to follow to wake up a sleepy baby. We should not try to beat the baby, but gently wake the baby and stimulate and look for the feeding cues. So next question is, what are all the feeding cues? When you will know that the baby is ready for the feed? So if the baby is ready for the feed, the baby will slightly start moving, open her eyes and look to the side and will show the signs of the rooting reflex. Rooting reflex is if you touch the side of the cheek of the baby, then the baby will open his mouth and will start looking for to that side. That is, rooting means looking for the feed, looking for the breast or the nipple. So that reflex is God given for the baby, and the baby will have that rooting reflex right when the baby is born. So the baby will start looking to the side and open the mouth and will show these cues. These are called the feeding cues or the hunger cues for the baby. At that time itself, the mother should take the baby and start feeding the baby. Later on, if the baby is not fed at this stage, the baby will start crying. Then the baby may become irritable and will also not latch if fed at a later stage. And then we end up giving some bottle feed or formula feed for the baby. So if we identify the feeding cues early and try to wake up a sleepy baby and feed the baby every 2 hourly, then we can ensure the proper breastfeeding. So These are the common doubts which mother will ask. So, like how to initiate the feed, how long to feed, and how frequently to feed, and how to wake up a sleepy baby, and night feeds are important. So, these are the common doubts which are generally asked, followed by the engorgement and balancing the work life and the breastfeeding. So, this can be done by expressing the milk and feeding those to the baby. So, I think I have covered almost all the aspects and the general doubts related to the breastfeeding. And some common myths are like, is my breastfeeding related to the jaundice? No, breast milk is not related to jaundice at all. Mother's diet does not affect jaundice at all. Mother eating non-veg or egg or any other stuff doesn't affect the jaundice. Jaundice is occurs due to a separate mechanism. I will not go into the details of those now. And so, if mother eats something that will not related to the bloating or gaseous distension of the baby, so mother need not be put into extreme dietary restrictions to avoid these problems for the baby. And what to do if the baby is extensively gassy or crying a lot and all. So burping should be taught to the mother and the attenders. So after breastfeeding, the babies tend to swallow a lot of air into the tummy, and they can't remove that air unless we do the burping for the baby. So this tends to cause the gaseous distension of the belly and the discomfort of the baby. This can be avoided by putting the baby on the shoulder like this, on the shoulder, and tapping the back of the baby for at least 15 minutes so that the baby burps 1 or 2 times, and then only the baby should be put down to the sleep. Otherwise, the baby tends to vomit all of the milk in order to relieve that distension. So, regular burping should be advocated after breastfeeding, frequent breastfeeding, and latching the baby for a longer time, and looking for the latch and suck related issues like shallow latch, the ones which I've already discussed, nipple issues, latch issues, and looking for the appropriate latch. There are certain scores known as latch scores, which determine the latching of the baby, the type of the nipple, and the comfort of the mother, whether the mother is holding the baby properly or not. There are two, three different types of holds. Out of that, the common ones are the cradle hold and the cross cradle hold, in which first the mother should sit comfortably with a rest to her back and neck, and she should be feeling comfortable, and then she can use a feeding pillow and she can hold the baby. The entire back of the baby should be supported by the mother's forearm, means from the elbow to the hand. Her hand should rest on the baby's back buttocks. So in that way, the baby should feel comfortable. Baby should not be like falling down and feeling uncomfortable, which will help in inefficient latch, biting, and all those issues. So this positioning of the baby, like a cradle hold, in which the mother will feed the baby on the same side of the hand which she is holding the baby. In the cross cradle hold, the mother will hold the baby from one hand and feed the baby on the opposite side. For some others, like who have undergone the cesarean and all, where they will have the pain over the abdomen, football hold is also taught to the mothers, in which the mother will hold the baby with the help of a feeding pillow towards the side of her body and then feed the baby. So these are the common holds which are taught whenever a lactation counselor comes and assesses you, and that help in feeding the baby properly. And the latch should be deep enough in which the nipple and the areola is the black part outside the nipple, that part should be entirely inside the baby's mouth, and the baby's mouth should be wide open, and the lower lip should be averted, and the baby's abdomen should be touching the mother's abdomen. This is the ideal breastfeeding position and the ideal latch. And the baby should be initially the sucking will be a bit faster. Then, as soon as the milk starts coming in, the sucking will become slow and deep sucks will be there, and the baby will be allowed to suck as much as she wants, and the baby will automatically leave the breast once she is satisfied of the hunger. The other cause for sore nipple or cracked nipple is the whenever the baby is unlatching, The baby should be gently allowed to slip off the breast, like by if you want to remove the baby, suppose the baby has slept but is not sucking anymore, you know that the baby is satisfied. The baby doesn't want any more milk, but she's not living means we can put a finger slightly on the edge of the baby's mouth, which will ensure that the suction or the grip is gone, and then remove the baby from the breast. In such a way, we can avoid the nipple cracks. The other doubt which is caused asked is what to do if there is a cracked nipple. So then the mother can apply her own hind milk, the milk which comes in the end after finishing feeding the baby. She can apply that over the cracked part that will help in healing. And she should avoid wearing the tight fitting clothes, which also causes the pain over the breast. She should go for the loose fitting and comfortable clothing. And she need not wash her breast every time with the soap after feeding the baby. That also leads to the dryness of the skin and cause cracked nipples. If still that is a problem, even after applying the hind milk, there are some ointments which we generally prescribe for the mother. I hope I have covered most of the topics that have been allotted to me. And if there are any doubts or any Q&A, I am ready to take up those questions. Thank you.
Hi, ma'am. Thank you so much for your time, and it was a really great session and such an enlightening session. I think you actually have addressed majority of questions, but I think we have, since we are live, and we have one or two that I can see there. So one is that what kind of a diet should a breastfeeding mother entail? Or is there some foods or something that she should avoid for a healthy feeding? And yeah.
Yeah, that's what I have already mentioned. There's nothing like the mother should avoid. So you should not put the mother at extreme dietary restriction. She should be taking a wholesome, nutritious, balanced diet. So in our Telugu states, people will say patyam and all this. They'll not give most of the vegetables, nothing, the pulses, nothing will be given to the mother. This is not a good practice, and she should be allowed to have a healthy, nutritious diet which is rich in whole grains, pulses, and she can consume dry fruits also, healthy food, vegetables, fruits, everything she can take. There are no dietary restrictions for a breastfeeding mother, and in fact she should take a slightly additional calories, so that in addition to her she should also breastfeed the baby, and the baby should receive nutrition, no? So she should receive consume at least 500 to 600 additional calories and additional protein, so that her milk will be nutritious to the baby. So if you see the galactogogues, these are the substances which increase the milk production. There is no harm in consuming them. Like you say, the natural ones are the garlic, methi, oats, drumstick, or dry fruits. These are the things which increase the, like barley. They increase the milk production. There is no harm in giving them to the mother, but she should not be put to the dietary restrictions, in which a majority of the items are avoided, like non-veg and all, everything she can take as long as it is healthy and homemade. So what I would suggest to not take is the things which we buy from outside, spicy and oily stuff. Outside food she can avoid in the initial few days, like at least 6 weeks until she recovers. But healthy homemade food she can consume of all the things.
Thank you so much, doctor. When you say that she has to take some more and add on to some more food to her diet so that she can have better milk production and everything. So, do they have to regulate their BMI as well, or is there like control over? They have to take a control of body weight also, or I mean, is it fine if they have a BMI of 30?
So, the BMI, actually, it's better if she controls before the planning pregnancy and delivery. Just a minute, I'll
Okay,
have to take a call.
sure, please.
yeah. Sorry for the interruption. I had an
No
important
worries, ma'am.
call.
No worries. I completely
Uh, so,
understand doctor's schedule.
so yeah, where were we? We were in the diet for the mother, no? And
Yeah.
yeah, BMI and all, it's better that if she regulates before planning the pregnancy itself, that would in fact help for becoming conceiving also. But after like delivery and all, so in the initial 6 weeks, anyway, they are not going to do like much of physical activity, exercises, and all those things. So she should put the focus on like taking, healthy diet. So healthy diet, nutritious diet. I'm not saying outside food, junk food, and all those things. So she can take the healthy, nutritious diet and a bit more. So because she is breastfeeding her baby. And generally, a mother who has recently delivered will be prescribed the calcium and iron supplements. So that also help in maintaining the calcium and iron levels for her newborn. So it would be good if she continues that as per the advice of her obstetrician.
Thank you so much, ma'am, and thank you so much for taking out the time. I'll ask if there are any questions. We'll just wait for just a second, few seconds, and if they are not, then
Yeah.
we'll. So I guess there is no more questions. So thank you so much, ma'am, for your time and taking so much of efforts of delivering such enlightening content. And I really appreciate that you have addressed that whatever doubts. I mean, I personally don't know, but you have whatever doubts that majority of people or breastfeeding mothers might have. So thank you so much, ma'am. Thank you so much for your time, and thank you all for joining as well. And
Yeah,
if
thank
and
you. Thank you for giving me the opportunity. I hope that was an educating session for you all. If
yeah,
you still
definitely.
have any doubts, you can just email me or contact the King's Hospital or just come in any time. So we would be more than happy to clarify your doubts and solve your breastfeeding related queries. So, because that is the most important thing that a mother can do for her baby, which increases the baby's IQ and the overall the growth potential. Yeah.
Definitely. And if somebody missed this, then this video is always recorded on YouTube, and they can just go on our Nano Health page, Assurance by Nano Health, and just see this
Yeah.
live talk that we have done. So, thank you all for joining. Thank you so much, ma'am, for giving your time, and thanks to Rashmi as well for organizing all this. Thank
Yeah,
you so much,
and
ma'am.
one last thing. This
Yes,
is
ma'am,
a
please.
World Breastfeeding Week. Now, the first week of
Yes,
August is
yes,
the World Breastfeeding Week. On the occasion only, we have done
yes,
this
ma'am.
talk. So, the theme of this is that we should close the gap and give support to the breastfeeding mothers. So, the
Yes.
family support is the very important in such a case where these myths and all these things should be avoided, and early and successful breastfeeding should be encouraged and supported by the family members as well, and the people in the like office and all that. Some breaks like nursing breaks for the mother should be provided so that she can continue her breastfeeding.
Definitely,
Thank
ma'am.
you.
We have done. Thank you so much, ma'am. Thank you so much.
Yeah.
Thank you all for
Thank
joining.
you.
Thank
Yeah.
you.
Bye.
Bye.